An approach to perioperative risk assessment. This video will be a brief overview for both high-yield general surgery and high-yield internal medicine review playlists. Thank you for joining me. Let's get into it. There is no standardized approach to perioperative risk assessment and stratification. However, the overwhelming attention will be placed on cardiac and pulmonary optimization. I like starting with the ABCDs approach. Has the patient had any prior difficulties with prior sedatives or induction agents during the perioperative period? Does the person have a personal or family history of bleeding or clotting disorders? Is there a past medical history of coronary artery disease? Am I in the past 6 months? D is for drugs and adverse effects of other medications. This will include things such as chlorhexidine prep, latex, for example. The two most popular perioperative and postoperative calculators to assess for lung complications for surgery include both the STOP-BANG and ARISCAT. STOP-BANG is a quick and easy scoring questionnaire to assess the likelihood of a patient having obstructive sleep apnea. It includes both subjective scoring, such as the patient admitting to snoring loudly or feeling tired or groggy throughout the day, but it also includes objective measures such as neck circumference and body mass index. An elevated score places the patient at risk for obstructive sleep apnea, or OSA. Knowing whether or not a patient is at risk for OSA helps the anesthesiologist and surgeon tailor their treatment to managing the patient in the recovery room and in the surgery. Anesthesia may have additional backup airways, or the patient may benefit from extended PACU monitoring. ARISCAT is another tool to assess for postoperative pulmonary complications and takes into consideration the type of surgery, how old the person is, and underlying respiratory function. An elevated score may pose the patient at an increased risk of infection, pneumothorax, bronchospasm following surgery. More helpful, I would argue, is what you can do with an elevated ARISCAT score. Guidelines recommend shortening surgery time and encourage additional preventative strategies. I will link these calculators in the text box below. Revised Cardiac Risk Index for Preoperative Risk, or the RCRI, is a staple risk calculator for cardiac complications for non-cardiac surgery. This scoring system takes into consideration history of ischemic heart disease, heart failure, history of stroke and TIA, whether or not the patient is dependent on insulin, and underlying creatinine clearance. All these are given a scoring system, and those who are at a Class 3 risk portend to a 10.1% 30-day risk of death, MI, or cardiac arrest. These patients typically undergo additional cardiac evaluation, and you can look at these things such as BNP and troponin levels for further risk assessment. For this lecture, you don't need to know all of that. Just know that the more complicated the cardiac patient, you may need to call your cardiology friends for help. Now, if you are passionate about perioperative evaluation, I will add some additional literature for your review in the text below. So those are the two big organ systems you need to know about and how to manage and optimize prior to surgery. My favorite surgery calculator is the National Surgical Quality Improvement Program's NSQIP calculator, or NSQIP. It is a very comprehensive scoring system that takes into consideration chronic disease states and, more impressive, the type and specific type of surgery. At the end of the extensive review, it will give you a percentage of all-cause mortality, infection rate, cardiac complications, and interestingly, it also gives you a section for dispo planning, so the likelihood the patient will be discharged to a SNF or rehab facility. I like this type of calculator because I can tailor it to the specific surgery that the surgeon will be performing. That's all for today, guys. If you found this review helpful, please leave a comment. If you have any other questions, please reach out. And as I stated earlier, all calculator links will be attached for your viewing. Thank you for all your support. See you in the next video.